So in this video, I want to talk about obesity and infertility. And before we get there, I do have a number of caveats. The first being that fertility and infertility are very personal subjects to a lot of people. So be careful with how you share this information. And lots of people with obesity do get pregnant. It's not like black or white. There's a lot of stuff we still don't know about obesity and fertility and infertility. So just be a bit careful on how you talk about this. When I say infertility, the definition that's typically used is the inability to achieve pregnancy after a year of unprotected sex, and that is due to female factors in the female, but could also is often due to factors in the male. So we'll explore both of those things. A couple other things to keep in mind is that a lot of this data is based on BMI, and BMI doesn't tell us about body fatness per se, although it can give us an idea, especially at higher BMIs. It's hard to directly link body fat and potentially infertility, although leptin might give us some clues to that. And there's no causality that has been established with this. So just be careful with a lot of that stuff. I just want to kind of explore some of the themes that are going on in the literature around this topic. A lot of this data is from industrialized countries, so keep that in mind. And the number one thing that affects fertility is age. That is something that's also something that increases likelihood of obesity, is increasing age as well up to a certain point. So that might be a confounder. Again, I'm just trying to be cautious with this information. And if you're not one of my students and you're watching this and you're kind of dealing with your own fertility situation, I am not a medical doctor. Please don't use me as medical advice. Please always speak to your primary healthcare practitioner about this stuff. And also lastly, I just wanted to send a shout out to Emilia Ruffett, PhD student in anthropology, who's fascinated by fertility. And she helped me with a lot of this data she provided a lot of this data that helped to put this presentation together. So thank you to Amelia. So first of all, you'll often hear conversations around fertility and BMI, and this conversation around a J-shaped or a J-shaped or a U-shaped curve, where kind of the maximum fertility is found around what would often be called a normal BMI, in and around about 20 to 25 BMI. We tend to have, especially when it comes to ovulatory infertility, which is what this particular graph speaks to, that seems to be the range where we have the least likelihood of ovulatory infertility. So there seems to be something going on when it comes to weight, maybe with body fatness, where being on the lower side of BMI or on the higher side of BMI, there's something going on with fertility. So one of the main hypotheses about what is potentially promoting infertility in some people with obesity is some sort of hormonal dysfunction, and the main hormone that is discussed is leptin. Leptin is believed to have a role in the menstrual cycle and in the ovulatory cycle. Leptin and luteinizing hormone are both believed to be involved in ovulation and the maturation of the oocyte as well, and there are leptin receptors on the follicles in the ovaries too. So given some credence to the belief that something's going on with leptin. And as we know, in obesity, we have this expanded adipocyte tissue, which means more leptin release. And we believe that perhaps those higher levels are impacting both female and male fertility. To that end, there seems to be a link between leptin and the hypothalamic pituitary gonadal axis. The best example of this, or the most well-researched part of this, is that higher levels of leptin are associated with lower testosterone in men, which we know is very important for the quality and the amount of sperm that are produced by the testes. Another argument to support that leptin might be involved in fertility in males is that if you look at individuals with obesity, those that were more fertile tended to have lower leptin levels, again suggesting that higher leptin levels, which we see in obesity, is something that can impact fertility. Another factor that has been implicated in an increased chances for infertility in males in particular is that in obesity there might be a higher likelihood for fat to accumulate around the testes. impacting spermatogenesis. So if we don't have good sperm or enough sperm, that can impact the likelihood that one of those sperm is going to meet the oocyte. That said, not all men with obesity accumulate fat mass around the testes, but another argument that supports that this might affect infertility is that when some of that fat mass is removed, fertility or spermatogenesis does seem to go up. So again, something might be going on with more of the fat mass aspect of the obesity with respect to promoting infertility on the male side. On the female side, another thing that's been linked with infertility is polycystic ovarian syndrome. And you hear the name polycystic ovarian syndrome and you assume that there's a lot of cysts in the ovaries, but that's not necessarily the case. This is more of an androgen situation. There's a hormonal imbalance, androgen excess, that could be promoting anovulation, so a lack of ovulation. With polycystic ovarian syndrome, like I said, some of these women that have this condition do develop these polycystic ovaries, but that's not necessarily necessary. What is kind of the main part of PCOS is this hyperandrogenism and an impact on ovulation. So symptoms of PCOS include irregular menstrual periods, excessive hair growth, and acne, as well as difficulty getting pregnant. And there is an association between obesity and PCOS, but again, we need to be cautious because we don't really know the direction of the relationship. If it's PCOS that's promoting a higher risk of developing obesity, or obesity that's promoting a higher risk of developing PCOS, all we know is that there's an association there and there's an impact on potential ovulation and accordingly fertility as well. Last thing, last kind of argument as far as potential ways by which obesity might link with infertility. We covered this when we talked about cancer, is there's an increased risk of certain female reproductive cancers with obesity. So we see higher risk of ovarian cancer and endometrial cancer as well, which can of course affect a woman's ability to get pregnant and then keep that pregnancy as well, especially if there has been surgery involved with either of these conditions. So just wanted to provide a few different mechanisms by which obesity may promote infertility. But again, I really want to stress that this isn't that no one with obesity can get pregnant. That's absolutely not the case, but it can impact fertility. We do see differences in individuals with obesity versus individuals without obesity. But I just wanted to put this last slide in as well to say that there's a lot of things that affect fertility outcomes beyond just weight. There's socioeconomic factors that are implicated as well with fertility outcomes, and of course dietary risk as well. And then age is the number one thing that affects fertility outcomes. So something to keep in mind. We never want to jump to conclusions, but we do know there's a lot of things that obesity is associated with, and this is one of those other ones.